So we will head to the second case today, and I will take up the Q&A later. So let me introduce you the second speaker for today's presentation. So this is a very uh, very different case. There's a common belief across the crowd that aging, chronic pain, or decades of unhealthy habits are irreversible. People obviously think that, like 70s, once they're 70s plus, 80s plus, that's how the perception of people are. But this particular case study is an inspiring story of a 78-year-old gentleman who lived years with fatty liver, chronic knee pain, and poor mobility, and multiple more things. But how he has healed, we will hear the story of this gentleman through Dr. Karuna from Hyderabad. Welcome, Dr. Karuna. Over to you. I'll share the slide for you.
Welcome, Jyoti. Welcome to all of you. And thank you, Jyoti, for the lovely introduction. Yeah, this is about a person who was 78. This was in 2024. And he worked in an international firm in Hyderabad for almost 40 years. And his life was a very, was a life full of socializing all the time because he had to visit almost 100 countries, and his position and his status was like that. So, apart from that, he did have a very strong family support because his son owned a hospital, his daughter-in-law owned a hospital separately, and his own wife also owned another hospital. So, three hospitals, three of them had in the family, but all of them treated him with allopathy, and still he had the lower limb pain, and he was not very happy the way his life was going on. So he had everything. So one day, I just spoke to him. I approached him. So he said, I believe in my motto is live life king size. I drink every day. I play cards to while away my time. I go to the race course because this is what pleases me. But this is the only thing which is bothering me, the low limb pain. And I've gone to all the doctors. I've done all the tests. I've taken medication. I've taken injections, everything, but it just didn't happen. So then I explained about the holistic approach, and he was very reluctant and he didn't want to take it. So I told him, you just try it, and it's not about medication or supplements. You just give it a try, and if you like it, we'll go ahead. And this, he took it very well and went on for 6 months. So his expectation was zero. He thought he'll give it a try, and this is what happened to him. Next slide, please. So the previous slide. Okay, the 60-year imbalance. It's about the next slide, Jyoti. Yeah, thank you. Yeah, so this 6-year imbalance was because from the age of 20, he would have alcohol every single day, and it was minimum of 3 pegs. So he was so used to having alcohol, though he says he's not addicted to it, but it became his companion actually. So the metabolic toll over here was like his BMI was 31 and his weight was 100 kgs, and he had a very big waist size, and fatty liver markers were elevated, and he had hypertension. And apart from that, he had severe lower limb pain and sciatica and osteoporosis because of his age related issues. One good thing was over here, because his bedroom was on the 3rd floor, he would walk every day, climb 3 floors. For all the 3 meals, he would come down. So that way, his heart health and everything was very good, except that the knees and the legs gave in later. And so as per the psychosocial toll, because of the alcohol dependence, and every evening he would drink, and along with the alcohol, they would be very high refined carbs, and he loved those fried snacks and mirchi bhajis and all those. So that actually increased his weight, and it. I mean, he couldn't walk further because of that. Jyoti, next slide, please. Yeah. So then I explained to him about the integrative blueprint. And I told him we'll do it for 6 months because in 3 months, it's difficult to reduce alcohol, which he's been doing it for the past for 40 years. So I took a holistic approach and I told him this has got nothing to do with his age. It's just a metabolic barrier. It's a habit barrier which he's got. So we need to change that habit so that he lives a healthy life. So I told him we'll start with Ayurvedic nutrition because everyone's an allopath in his house. So he was okay with it. And I gave him a Prakriti evaluation chart and he filled it up. And then uh, after I saw the chart, it was like his pitta and kapha were elevated, which means like, it's a very hot and heavy state. Then, I covered all the 7 areas here itself because physically, it was about the food, about lack of exercise and sedentary lifestyle, and sleep also was bothering him. So, apart from that, professionally, he's retired, so he was just relaxing. Socially, he was very, very a known personality everywhere. So he would go for parties, and every single day he had something or the other to attend. So we worked on his movement, and I wanted him to have this strength training. So I made him join a gym, and he was very excited because in his life he never went to a gym. So he bought a tracksuit and he bought new shoes, and we like just a small kid. Then I put him onto a trainer, and they made him walk slowly. And by the end of 6 months, his strength training, everything improved. So he was so excited, and there were days I used to tell him to swim so that he didn't get bored. And some days physiotherapy, massage, sauna, steam. So it was a very very different kind of approach. Which he enjoyed. It wasn't like going to a doctor, getting a blood test done, getting these reports, waiting for the doctors, then a big waiting for the procedure and all that. So it was totally a very, very different approach. And he just loved it. And every day he would ask me, Madam, tomorrow, what should I do? So he was very excited. So apart from that, the behavioral substitution was very important because the habit to replace that, it was a big task. He always said, don't remove my alcohol, you reduce it. So I believed in that. I always wanted to taper the alcohol, but I didn't want to replace it. So he was very happy with that. And coming to the inner alignment, he required that because he was not at all convinced with such approaches where, if his energies are blocked. And when I told him about the chakra healing, it was totally rocket science for him. When I told him about the breath work and meditation also, it took some time. So after the counseling and all that, he was aligned to all the uh, next slide, please. Yeah, so here we were identifying the roots of pathology. So Pitta is hot and Kapha is heavy. So I focused more on the healing. So I told him he has to, because he was very hot-headed and always angry, authoritative, and he also had this hypertension and frustration, all those. And he loved the Mughlai food and the spicy masalas and all that. So it was totally a pitta imbalance. And kapha also because he was lethargic and it was always heavy. And he gained a lot of weight and he had fatty liver. So I told him he has to speak gently, more with, warmth and uh, calm, compassionate, and all that. Earlier, he was very arrogant, and because of his position and status, he didn't realize that he was being like that. So slowly, he started realizing, and he started changing himself. So these 3 things I focused on. That was the dietary changes, where I gave him some bitter and astringent. Foods like ginger, turmeric, and pepper, etc. Then I changed his lifestyle because the exercise to break the kapha's lethargy and the pitta's frustration. I had to remove those also, and mood and behavior. So his arrogance, his aggression, his stubbornness, all this over a period of time did reduce, and he was more grateful and more understanding. Next slide, please. Yeah, so this was the topography of pain. So when I checked his chakras, because we had to do the chakra healing, so solar plexus, he had the primary block, and heart chakra and the root chakra, they were secondary blocks. So accordingly, we I treated him for that. Over to the next page. Next slide. Yeah. So here I focused on healing the energy blocks, and because they were not aligned. So he had to understand. So I sent him videos of chakra alignment for him to understand. And just before sleeping, I would tell him to just listen to it and meditate. So slowly he got into that grind. And so I started with the solar plexus because that was the main area where he had the physical symptoms related to the stomach, intestines, kidneys, and liver. So we focused on his acid reflux and bloating issues. And I gave him some yellow colored fruits and vegetables like banana or lemon or all the yellow vegetables. And I also gave him some complex carbs, oats, beans, grains, etc. And we also concentrated on manifestation and breath work, mindful eating to release all the emotional heat. So the fear of judgment, he was a people pleaser. So we were working on those. And coming to the heart chakra also, I incorporated green foods like peas and kiwis and lemon. And he was unable to trust people. It looked like as if he wasn't even trusting himself. He was not at all compassionate. So I made him do mirror work, self love, forgiveness, and gratitude practices. So he wouldn't write in a journal. So I used to send him WhatsApp messages, and I used to tell him to read it whenever he's in the car or in the night. So reading messages for manifestation was more easier, affirmations. So this is how he also created that self-love within himself, and the emotions were slowly unblocking from his heart. And coming to the main, the root chakra, that's where he required the grounding because it was the lower back and the pelvic area and the hips. So because of the fatigue and the lethargy, uh, he had severe pain. So I told him to walk with barefoot on grass and every day exposure to the sun and work on the core areas, the strength training. So constantly I was in touch with the physical trainer and the physiotherapist. So we were actually working in sync and working on him. So every day he would come to the gym promptly by 5 p.m. and he would wait for what next, what next. It was like that. So he was very excited. He stopped playing cards, and this took most of his time. So people would ask him, "What happened? Why aren't you coming today?" And then people started seeing results on him. He was glowing like a young boy, and he lost weight, and he started coloring his hair, and he changed his dressing also. So people thought there was someone in his life. It was like that. So many changes came. Uh, Next slide. Yeah. So the replacement was the toughest one. So minimum 90 ml, that is 3 pegs he used to have every day for the past 40 years. So when I explained to him, I said, I'm not removing the day, but you have to make it to 2 pegs, that is 60 ml. So the first month he was okay. 30 days, 60 ml every day he would have. Then the next month also he was happy that way. But in the third month, I reduced it to 15 days and 30 ml. So that bothered him. Suddenly, it's only 15 days, alternate day. Every day I was having now 15 days. Can I cope up with all this? And he was worried, but we did manage. So I was giving him soups and Hunza tea. It's an antioxidant and anti-aging and weight loss drink. So I gave him that, and I said instead of at that time when you have to have liquor, drink this, and or have an early meal so that you finish your dinner and it's over. So he tried all those, but in the fifth month again he said I can't. 15 days is tough, so increase it. So I made it to 20 days again. From 15, it went to 20 days. So, but still, he didn't say anything. We stuck on to 30 ml. He was pretty good. And in the last month, I said, "This is the 6th month. I can't handhold you for the whole year. You have to do it on your own." So then he understood and he said he will do it. And 30 days, but we made it to 30 ml, but 4 days. So that is 16 days in a month he was having. So there, I stopped it at that. And then he got his blood work done. And so he, apart from losing 8 kgs and 8 inches, because we were not concentrating on the weight or the inches, we were concentrating on the pain. But because of the pain, we ended up where he got so many advantages by losing weight, the pain reduced. The fatty liver vanished, and all positives he got. So he was very, very happy. And you can see the reports after and before the liver function test. The next slide, yeah. The next slide, please. Yeah. So the identity matrix before and after, the results were very, very encouraging. Even his children and his wife are so happy. And now he keeps asking, though it's 2 years now, what should I do? Because he's stuck on the 30 ml. So I just keep giving him advice what to do, and he still follows it. So he's doing pretty good. And before it was 90 ml and deep fried food. Now after 6 months, he goes and meets his grandchildren in that time, because that is the time where when he used to have liquor. So that time he's very, very aware now that what he has to do, how he has to pass his time. So he either has meaningful conversations with his wife and family, or he's having a soup and an early dinner, or meeting someone. Even the emotional state, he was very arrogant, impatient, and he was very, very resistant to change. But now he's very understanding, he's grateful, he's patient, and he's changed a lot. He could see the transformation in himself. And physically, he was confined because of the pain, and he had a sedentary life, but now he understands it's all within him. He could do it, which he didn't know that he had to do it all these 40 years. So he's now very, he's looking forward to go to the gym or swimming. Uh, Next slide, Jyoti. Yeah, so this is in the gym. He's even bending his legs. So this shows that his pain is reduced. He does the strength training and squats. So there's a marked improvement. Yeah, so it says that age is not a barrier to healing, only one's willingness to begin. Isn't it's true? Because the healthy habits, only when we start, all these results show. So he understood that age is never a barrier, even if you're 70 or 80, because you still gain muscle, and your bone health also improves. So he's understood that, and his overall health has improved, and he's very happy. Thank you.
That's an inspiring story. To bring in, we have two contrast variations. If you see the case studies today, one is the story of a youngster, and the other one is the story of a 70-plus-year-old man. And but how we can bring up changes, and age is always never a barrier, it's just a number. So thank you for presenting these two beautiful cases. We are open for the questions and discussions. Over to you guys.
Wow, wonderful, wonderful case studies. In the last conference, we heard about Hanuman, but we never knew that Hanuman was undergoing so much of emotional trauma and all that. So nice to see that she got out of all that. And
Thank you, ma'am.
someone called you Hanuman, right? So I was just
Yes,
recollecting
for
that.
sure.
Okay, okay. Okay, okay. That was very nice. And coming to the next case study, wow, that too wonderful. bringing change in 70 years old is like 70 plus years old is like wow. I mean, they generally don't listen and all that, but you somehow managed to get that resistance out of him and then managed to get the change. So that is wonderful. Thank you.
Thank you, Padmaja. Okay. So meanwhile, if someone else comes with the questions, I have a question for you, Karuna.
Yeah,
So
please tell
did you
me.
try any holistic tools with him?
Yes.
Okay. Oh, so
Forgiveness, affirmations,
what,
manifestation, breath work, yeah.
okay, what worked
What
the
did you
most
say?
for him? What worked the most for him?
What worked the most for him? Actually, he was very excited about the exercise because for him, he didn't understand what holistic tools were. But I kept on telling him it is about the inner work, inner work. So he thought, only dieting and exercise will reduce. But he didn't understand that it is the inner, the hormones which play a role. To be happy from within your, see, serotonin is made in your stomach, in your digestive system. So I made him understand about the gut-brain axis and whatever stress, if it's in the brain, it's here and all that. So then he started doing the inner work and affirmations and all that. He started forgiveness, gratitude, and with his even servant, he started being very nice. Otherwise, order, get it, do this, like that. So there was a transformation in him. That arrogance is gone. That status which was there, it's not there now. But then still, he feels that he's in that state. So everything came down. His ego. So
Wonderful.
all the holistic tools only work because it's forgiveness, it's gratitude. He started contributing to wherever it was needed earlier because he had so much money. He was into gambling and all that. But now he felt instead of doing that, that is okay, a passion, but over here he felt contribution. So in the 7 areas, I told him in the spiritual area, you have to do monthly 5% you give. So he's learned a lot.
Great, great. That's wonderful. So coming to you, Gayatri, it is I know you since couple of years, and there was a lot of things which were kept unresolved and hidden, even from your own end to the external world, even to your best friends. So I wanted to ask you and tell people what is that one thing which made you break the cage and helped you to start your healing journey to open up.
The burning process and gratitude, ma'am. Like while I was writing them and as I was showing this gratitude and all, I was, actually seeing the world around me, how they are, how much they cared for me, and I never realized. So that way, doing these practices helped me, what that shift in my thought.
Great. So keep working on, continue the work. So that's the very important thing. So yeah, we have any more appreciations or more bigger hearts for the presenters today? Or any discussion points?
I have a
Ma'am.
question.
Yeah, go on, Elizabeth.
Case study with the man over 70 years.
Uh-huh. Go on.
I just wanted to ask Karuna ma'am if she had to change the way she gave advice because he's over 70, he's having what we would consider maybe a larger ego. He might resent having being given advice, especially on tools that he's not heard of before, because we know that holistic principles, they're laughed at even by people who are younger than 70. So to be given these holistic tools and holistic principles by someone younger than him, did you have to adapt the way you gave him advice? Did you have to say it in a different way? Did you have to use a different tone? Did you have to adapt the manner of speaking, or did you say it as you would to any other client?
Karuna, it's for you.
Sorry, once again, please repeat. I didn't I didn't hear. I was on a call, sorry.
No, I
What
was
did you
just
say?
wondering, since he's a slightly older gentleman, I was wondering whether you had to adapt the way you spoke to him, since he's much older than you, since he's also not very familiar with holistic tools, and holistic tools are sometimes even laughed at by people who are far younger. So since these are all very new principles to him and very new, it's a very new topic. He's being advised by someone so much younger than him. I was wondering whether you had to adapt the way you spoke to him or whether you were able to speak to him as you speak to all your other clients.
No, I had to change my way of talking because see, he had his wife and children are doctors, and they're very, very well-known doctors, and they have hospitals in Hyderabad. So I had to explain to his wife too what this approach is. In fact, uh, he actually listened to me because it took almost 1 week, 10 days to make him understand what this holistic approach is. Because for him, he was totally clueless. So every day I would give him one thing, or I would send him messages regarding, about what do you call write something about the negativities and then burn it. So he found it very weird. He would take the lighter and burn the letter, and he would say, I did it only because you told me. So I said, no, you can't do it because I told you. It is because you have a lot of pent up anger, frustration and all that, so you'll feel better. So every single day I used to make him understand. So over a period of time, 30 days, 45 days, he did understand this kind of approach. Because earlier he only thought, his mind was stuck where I'm going to remove the liquor. You got my point, or you want anything more
I think
clearer?
so. No, I think I understand that he was kind of afraid of one thing about the when you'd stop him from drinking. So he was
Hmm.
willing to do everything else apart from that.
Yeah.
That was the point of fear. Right. And I also wanted to ask, like you mentioned affirmations. You mentioned he was very reluctant to write. And
Hmm.
that's why you used to send him affirmations via WhatsApp message for him to look at.
Yes.
So that worked for him without having to do any writing or without having to speak it out loud. He was able to read it and kind of internalize it in that manner.
Yeah, he used to send me the recording. He used to say, I am healthy. The gift of life is keeping me alive, like such things, whatever. I used to give him very easy ones because if I gave a little extended one, no, with two sentences, he wouldn't, uh, chant them, I can say. So he would send the recorded message also for me to believe it. He would send photos of what he was eating, and he didn't even know how to click a photo. He would tell his someone to click the photos. He was that, he transformed that much.
I'm just thinking he seems very motivated. After speaking to you, he seems very motivated and enthusiastic to do all that you gave him and to be consistent as well.
See, now it is 2 years. He's 80 now. He's still in touch with me. Or in fact, it's just a coincidence. When I was in the meeting, he's the one who called. He just called. He didn't
Synchronicity.
even know that I'm actually doing his case study.
Synchronicity.
Yeah.
You
He
could have
just
asked him
asked
to
me.
join the Zoom.
Oh yes, I should have actually. He every single day he has some doubt or the other. So he says, like, I've had a lot of non-veg in the afternoon. So is it okay if I can have once again now? So then I keep giving him advice. He's become so dependent. Something or the other he'll keep asking. Though it's 2 years. December 2024 he completed.
That's wonderful.
Just
Yeah.
one question about the yellow foods and the green foods you mentioned. You mentioned like yellow
Yeah.
foods for I think it was for the um, green foods were for the heart, and yellow foods were for a different part.
Solar
I was
Solar
just curious about
plexus.
plexus
that.
and Mooladhara. Root
Solar
is red.
plexus, yes, solar.
Yeah. So all the uh, chakras, you have different colors. So different chanting, mantras you have, and the different colors of food you can eat. So I give them according to that also. So I tried every possible holistic tool on him because I wanted something to work. And actually speaking, everything worked for him. When I did the Ayurvedic, the evaluation also for the Pitta and the Kapha, which turned out more than the Vata, he was saying like, why shouldn't I like spicy food? I like greasy food. I try to explain to him, see, this is how the body changes. You try it out. If you don't feel good, again, we'll go back to that. So every time, like a baby, I would convince him.
So are those people who are like more prone to frustration, are they more prone to eating spicy food? Is there a connection like that?
Spicy food?
Like those people who are
I
more
didn't
prone
get
to
you.
frustration. I think you mentioned pitta as frustration. So are those
Yeah.
people who are more prone to getting frustrated or more prone to anger, are they more likely or more, do they have an increased likelihood of liking spicy food, liking greasy food? Is there a connection?
Yeah, so that those are the markers for Pitta. Like there are quite a few. There are almost 100 points. So you evaluate in Ayurvedic way, like which one, the Prakriti, it's called. Which one is more? So then you get to know, and then accordingly you can treat them. So Pitta is like that. Kapha is like lethargy, weight gain, and on and so on. Fatty liver, etc. So that's how we evaluate based on all those. So I tried that. I tried chakra healing. I did the holistic tools, apart from diet and exercise, and he even swimming, physiotherapy, sauna steam, which he's never done. So many things in 6 months I've done that it actually worked for him.
Right, got it. Thank you so much, ma'am. Thank you. Beautifully
In fact,
presented.
if you come to Hyderabad, I can introduce you to him. He'll be very happy.
Okay.
Thank you for the invite, ma'am.
And thanks for the questions, Elizabeth.
Yeah.
Yes, guys. Do we have any more questions? So before we get to hear from others, so Gayatri, so finally have you started learning to say no?
Yes, ma'am. I wouldn't say completely, but yeah, most of the times, yes.
Most
I'm
of the
taking
time. So
stand for myself.
okay. So keep doing, because that shows that the journey is still on.
Yes, ma'am.
Okay. So anyone else wants to share anything?
Yeah, ma'am. Hi.
Hey, hi
Um,
Soumya.
Hi, Gayatri. I know she took a lot of time, ma'am, to open herself up, but it takes a right environment, for a flower to bloom, they say, right? I think she took her sweet time. And there is a saying, okay, love is everything. I mean, it can heal everything. And someone said, what if it doesn't work? Increase the dose. I think that's how I see her today. Yeah. Congratulations, Gayatri. I mean, all the very
Thank
best.
you,
So,
ma'am.
Yeah.
Thank you, ma'am.
uh, so wonderful. So more hearts for you, Gayatri. So we'll increase the dose of love, as Soumya
Thank
said.
you. Thank you, ma'am.
Yeah. Yeah. So yeah, that's beautiful. So if you have no more questions, sir, are you there? To come and have a few words for the presenters today.
Yes, I'm not sure about my signal. Can you guys hear me?
Yes, sir.
Let me check my signal's done. Yeah, it is 5G. Yeah. First of all, congratulations, both of you, Gayatri and Karuna. Those are
Thank you, ma'am.
wonderful case
Thank you.
studies, I would say. And yeah, I mean, I'm in actually two emotions running in my mind right now. One is I am quite happy with the way you handled the cases, and the anger is on the entire coaches, the team of coaches in HNT. See, when I was listening to Gayatri's story, when she got emotional and when she is narrating that particular thing, see, she is not a small kid. She is well educated. She did her master's, completed, and the kind of agony that she went through. Just imagine being in healthcare and being a postgraduate in nutrition and dietetics, and having access to so many senior coaches and colleagues and peers. Still, she has to go through a lot. Unless and otherwise, she might have mustered up the courage to share her story. We would never come to know about it. But now, take away Gayatri from the picture and imagine a girl probably studying an engineering or some other science or arts or something like that, suffering with the same kind of pain. We never know, right? But it is your job as coaches to tell these people, to create awareness on these people. People, they don't know. I mean, especially men, the stupidest race on the earth, they don't even consider what a menstruation is, what a menstrual pain is, and what do they go through, the emotional instability, or what you call, like, I wouldn't call it as instability, but the swings, the mood swings that they experience, and they just brush it off because they never experienced. I mean, I used to be such kind of guy when people complain of like physical symptoms like gastritis, simple gastritis. I never know how a gastritis pain is like in my entire life. But suddenly, for the past 2 years, I've been experiencing this post my binging session. Okay, suddenly there is some kind of heartburn, and I could see my gastric juices increasing and all this stuff, and severe pain. And I used to laugh at people suffering with this gastritis. Okay, then I started empathizing with those people. See, I'm saying this when I turned 44 or something. Till that time, I don't know what it is, right? So, similarly, people who don't understand or don't experience the pain that the other person is going through, right? You cannot offer what you say a clear cut solution to them. Now, all of you have this power and the people around you. Once you start telling the story, not exactly the stories, like, but the way you communicate in such a way that people get connected to you. I mean, that's where I come to the second part of it in Karuna's case. So, people usually after 70, I mean, even after 60, uh, they resign from the life. Okay. And they think that they have served their purpose. So I use this term spent force, right? I did everything I could do. There is nothing for me to achieve. So let's waste away my life, and whatever I have need to contribute, I did my job. Okay. And that is like what do you say? A stage where there is no comeback, right? They have license to enjoy their life, rest of their life. But look at this guy. I mean, worked so hard in corporate world and have seen the peaks of his career, and society respects him, and all these things. Suddenly, he was like curious. So, in Synchrodestiny, I mean, I don't know whether I did the book review on Synchrodestiny by Deepak Chopra. It is no coincidence. There are no coincidences in life. When she was present in a case, the guy actually called. So, vibrationally, she is matched with this client, with her client. Got it? So whenever we are thinking of someone and whenever we are talking about someone, obviously the person knows. As a coach, when you train up these things, right? These faculties, it is not very difficult. One day, I told Ravati, but she is handling a Brahmin patient, very old, bedridden, and I think this girl from Fars case, what's her name? Muslim girl,
Aisha.
Aisha.
Aisha. Okay, both of them are working. And I told Ravati at that time, see, if this guy is so adamant to your instructions, do you know a principle called getting into the dreams of your client? That was the first time. I mean, it happened almost like 2 years back or something. And she was like surprised. How can I get into the dreams of a person? So you can try. I mean, I gave her a small technique, which Sri M writes very clearly in one of his books. And then she said, like, sir, I'm not sure whether I'm able to get into it. Then I told her, it is not possible for you, but if Aisha tries the same thing, she can get into the dreams of this patient. And that guy hate Muslims a lot his entire life. Now look at the contradiction here, right? So then Ravati asked, sir, I'm a Brahmin, he is a Brahmin, and he is very devout and a very religious Orthodox guy. How come a Muslim girl can enter into his dream? That is a problem. Okay. So the moment you try to create those cages, right, calls for the action breaking the cages, right? So when Karuna, when she mentioned that he is like, yeah, what to do, madam? So he is trying something new. When she, I mean, I was looking at the chakras. I mean, like, why the primary block in solar plexus, not in heart chakra? I mean, I thought like she will be focusing on because the client's primary complaint is limping, lower back, lower limb pain, not the fatty liver, not the weight and all these things. Then I thought, why not root chakra? So probably Padma, if had she attended, or Neelam had she attended this class, they would be thinking in the similar lines. Those people who know about chakra balancing and all these things. So why not root chakra? Why only solar plexus? Because that's what root cause analysis gives you. Okay, and she is able to strike the gold over there, identifying that particular thing. So when the big gate gets opened, and there are smaller gates inside, when you break that fort that they have built for themselves, it's all defense mechanism. The moment the first thing got opened, and he became not gullible, I mean, not even vulnerable, but receptive to the ideas. So when Elizabeth asked this question, I mean, like when these people are so adamant and they're so fixed in this thought process, and whatever we talk about holistic practices and all, even younger people they laugh at them, and with older people with so much of knowledge and so much of background with them and experience, obviously the person with the kind of riches that he has built for himself, obviously he's supposed to be arrogant or like carry some air with him and all this stuff and getting advice from a younger one, even 1 year old also, it would be an ego trip for them. But she is able to break it because she is able to touch that chord. Now, having said that, I was reading recently a report or some article on how SP Balasubramaniam died. Do you know that before dying, he was in ICU for 2 consecutive months? Okay, and paid 2 crores in fee, hostel fee. He could have easily lived another 10 years of his life had he got access to one of holistic coaches. So the anger part, again, I mean, I told you right initially that I have two emotions simultaneously running in my mind. One is like quite happy the way you both handled the cases, one self transformation and then another one, an older man. But the anger part is this. So the reason why I am asking every one of you to present these cases. Now, imagine if people come to know today, probably hardly a handful of us are listening live to this case presentation, but we are recording this and we are putting up in our YouTube channel. It will be there forever, right? And people will come to know, discover that, okay, this is what it is. It can be done. So, though a small step, but a small step in right direction. And I'm quite proud and quite happy. As you can still see, I'm not in my office. I'm still traveling. But luckily for me, today is an off day. We are not going anywhere. Finally, I'm able to grab some time. And I think it is the attraction. I mean, don't feel bad, Kamalam. And I'm not implying that your attraction is not strong enough. But yeah. I couldn't find time even to open my laptop and uh, go through the recordings yet. But we keep on doing this, and I know that there are so many cases that needs to be shared, because when you do this, there will be so many opportunities opening up for us, and especially when it comes to menstrual hygiene or uh, basic hygiene of young girls, what they are going through. And Karuna and myself, we discussed about like school health program almost like 1 month back. We didn't go forward in that, but these things can be designed, okay, to create awareness. Information is not awareness, okay. Everyone has got information, but when there is a coach who is guiding you in which direction to go, right, then that becomes an instruction to follow, right? That kind of awareness we all can create. And keep up the good work, and special mention and thanks to Jyoti ma'am. So for past 3 weeks you have taken up the CNA series on your shoulders. Thank you very much, and hopefully I'll be back for the next session to host it myself. So only 3 or 4 days left on my trip, and very well done, and keep up the good work. I may not be attending all of this, I mean, immediately, but when the time is right, when your energies vibrate with mine, I obviously go through all the classes and make the clippings. And even I took a few screenshots of uh, Karuna also. Okay, I might surprise you, Karuna, but just hang on. Okay,
Okay,
you are on mute.
thank you, sir.
Wonderful, wonderful. I thoroughly enjoyed today's two presentations, just like I enjoyed
Thank
all
you.
the previous presentations. Yeah, very well done.
Thank you for your time.
So thank you everyone for listening to us today. So it's not only a story that we listen; the stories become the learning stones or the stepping stones to learn the new techniques to heal, no, oneself or many lives and bring up greater change in the well-being process. So thank you all for listening us today, and we'll see you all next Friday with another interesting case series. Bye,
Thank you. Thank
everyone.
you, Jyoti. Bye.
Thank you, Jyoti ma'am. Thank you, presenters.
And thank you, guys.